everyone. This is Foley Vision Center, and this is our Tuesday top of the month webinar. We're going to be doing every month now on Tuesday over the lunch hour. We want to respect your time, so we know everyone's radically traveling, eating really quickly, and we want to make sure that we keep everybody in the know. Hey, Amy, there we go. Good job. All right, so what we're going to do today is something a little bit different. We're doing a live treatment on Gabby. Miss Gabby there is being our wonderful patient. Gabby is our advanced laser esthetician, and so she's going to be having a live eye envy treatment. This is going to be really great because you get to see the whole thing and how we do this. And I think what we're going to find out, I think, Amy, I'm going to mute you for a moment so that way people aren't hearing the feedback. Is we want to show everybody what a treatment looks like, how long it takes. It takes about 10 minutes, 5 minutes per eye. And we're going to talk about why are we doing these treatments. As most people know, we're an ocular surface disease clinic here where we're looking at dry eye and all forms of dry eye. And it all starts at the lids. Getting good lid apposition when you sleep, because so many of us, we get a little air gap while we sleep, and that lid laxicity is a big problem for most of us over 40, and I represent that. As we want to grow here, we know that TempSure radio frequency is fantastic. It's an amazing technology using radio frequency waves to go deep in the dermal tissue, deciding the water molecules deep in the dermis. And when it does that, it excites the oil glands in the dermal tissue. And specifically around the eyes is the thinnest skin of our face, and it gets damaged the fastest from ultraviolet radiation. So wear those sunglasses when you're outside, take good care, have your sunscreen, make sure you're doing all the things you need to do, but then helping us with this, the radio frequency from TempSure, especially the new Eye Envy handpiece we're going to be showing today, is going to be able to show you how wonderful that treatment feels. It feels like a deep, warm massage of the eyes. I feel like it heats up your orbit so well and the sinuses back there. So if you have a little bit of allergies going on, oh my gosh, it's bomb diggity. It feels so fantastic. And so you're going to see how easy it is, how comfortable it is. We're going to give Gabby the ability to say yay or nay on how she's feeling. And Amy's going to kind of walk us through it. Stevie, of course, is with us, our glamour gal here, who's going to have our wonderful prizes today. And we have 3 prizes to give away today. We're super excited because we know we have a lot of folks tuning in today. We love all of our folks that tune in. We're so excited to keep doing this every month, and we want to make sure everybody gets what they need. This will be uploaded today as well, so you can watch this at your leisure to see how these treatments go. So again, this is an amazing new handpiece. We helped a little bit in the development with it, and it works beautifully in the nooks and crannies, and it gets the temperature very quickly, making this treatment very effortless, comfortable. You can do this on your lunch hour. We can do this year round. It is skin color blind, so we can do it on all skin types, and it is truly, truly relaxing. We even have people fall asleep on it when we do it. Amy is just like starts moving to the music. You're going to hear some interesting little spa tones. It just kind of helps relax you. She's so wonderful at getting people prepped in the weighted blanket, and they feel very loved. And I think you're going to all find this really fascinating. So I think what we're going to do now, Amy, do you have anything you want to comment before we move forward?
The only thing I'm going to say is I've already prepped her skin. So basically all we do is we take some alcohol wipes. For Gabby, we just did around her eyes because we're just doing an eye only. But if we were to do the full face, we would take the alcohol pads and wipe down her whole face. That way, we want to make sure that the skin is completely clear of the best treatment. I just say that that's what we did. And then we're just going to take some. This is the ultrasound gel that when you come in, my first questions I ask are, you allergic to gold or are you allergic to corn? Because apparently there's corn in the ultrasound gel. So we're just going to take a little tiny bit. It is warmed. It's heated by a little Tommy Tipper bottle warmer. So we're just going to put a little bit of ultrasound gel around her eye. And then I just wanted to show you really quick what Dr. Foley was talking about of our new hand pieces. There you go. So this is the old hand piece. You can see that little rolly ball inside of there, but that was what was the thing that was getting the hottest and would do the temperature. And the little plunger thing. This is the new one. You can see that one, it's a much bigger surface, and the plunger is so much down than the older one. And it glides, it literally glides like butter around the eye. All right, Gabby, are you ready? All right, here we go. You can see that this blue light down here at the bottom, it shows that I am coming in contact with the skin, that it's working. You see this green light tells me that we are already at temperature. Gabby, how does that feel? Is it too spicy?
No, it's like, it's hot, but it feels
bearable.
Yeah,
Okay.
I'm getting used to it.
All right. So with this treatment, we can adjust the energy settings to make it spicier or not so spicy. There are people that like it really, really hot, and there are people that don't like the heat as much. So that's why we have that flexibility. Oh, sorry, Gabby, I didn't mean to pull your hair. Flexibility to adjust. And then we're just going around the orbital bone. So each treatment is about 5 minutes. We're going to go around the orbital bone for about a little over 3 minutes. And once we get around the orbital bone, back and forth, we would take a piece of cloth and we will just lift up on the upper lid and pull down on the lower lid just to get as close to those lashes as we possibly can. I'll show you when we get there. We're going to do a full treatment on Gabby here. And then as long as I've asked the question, how is that feeling? Unless it gets hotter for them, which it shouldn't, because once we're at temperature, it should stay at that. But if at any point she feels like, oh, I'm used to it now, I can bump the temperature up. But once we get to this point, it's really just laying here and relaxing while we talk. I want you to feel completely relaxed during your treatment. And you can hear that music in the background. First question everybody asks me is, do you get tired of that music? Don't even hear it anymore, honestly. Like Dr. Foley said, this treatment can be done anytime. There is no downtime for this treatment. So once we're done, you can put your makeup back on if you want to.
And those that know me know I'm a talker. This one, it makes it like you're just so tired, relaxed, where it's like I don't even want to talk. I'm just gonna sleep. Feels so good.
So of course, with this treatment, we are going after those meibomian glands. We're trying to unplug them. But a side effect of this treatment is it does help with the fine lines and wrinkles around your eye. I don't think Gabby has to worry about that right now, but she's still a baby. All right, now we've come to the time where we're going to do her lids. touching. So when I do her lids, we don't use the same energy because your lids and your underneath your lower lid are very delicate. So we have to turn the heat down just a little bit. Ready? Good.
I'll let you know.
Essentially,
Well, we're at temperature.
so as Amy said, she's turning down the energy. The temperature stays the same, but the energy goes down when we go on the thinner part of the lid. And we're able to get right on those meibomian glands, so that helps with expression. This really improves the outflow of the oil that produces a good chunk of your tears. And 86% of patients who have dry eye, it's due to these oil glands getting clogged or recessed or atrophied. So TempSure does a fantastic job at getting those open and flowing, and it's a very comfortable technique that patients really enjoy. So she does a full warm up of 3 minutes and then does 1 minute upper and 1 minute lower on the lids themselves. So how's Gabby doing?
Just try not to fall asleep. I still have to work after this.
How's the pressure?
So nothing crazy. I do know it's definitely different if you haven't had the new handpiece. It used to feel a little bit more pressure on the upper lid. I feel like the lower lid was always pretty easy, but the upper lid is a lot easier with the new handpiece. And I mean, again, I could probably knock out with this, so it's definitely not too much pressure.
Good. Okay, that's one eye done.
Awesome. I think that's great. I think what we'll do is we'll let you guys keep going on the other eye. And then while they're doing the other eye, I think we're going to have Stevie giving some prizes away here. And definitely, I would say if we can have Marina zoom it a little closer, and I'm going to spotlight. Oh, I think we have a question here. Let's do that. Okay. Is TempSure Envi treatment compatible for these conditions? Glaucoma, wet macular degeneration, cataracts, both post and pre-surgery? Great question, Terry. It's not a problem to do TempSure if you have glaucoma, but it's not going to cure glaucoma. Glaucoma is about the back of the eye. We're looking at the front, but it's totally safe to do on our glaucoma patients. And I think the other question that you have, which is wet macular degeneration, it's not a problem to do with patients who have wet macular degeneration. And it's okay to do before cataract surgery and post. In fact, pre is a good time to get that ocular surface in really good shape. So that way you can improve the ocular surface to make the surgery much more effective. And so very, very important on that. So that's a great question. I think we're going to try doing a little spotlight if I can too, so you can see a little more of the treatment. So you'll hear me kind of talking a little bit. So essentially, as you're seeing that going around the periorbital area, it's heating up and using the bone, the periorbital bone, to heat up that tissue. Bone conducts radio frequency waves really well. If there are any singers out there, we use good old tuning fork to hear really well. And so it does a beautiful job of sending that through. And you can see how really effortless and smooth that is. It's working primarily around the eye. We can do the whole face, but this eye Envi handpiece does a beautiful job getting in the nooks and crannies there. And that's what we want, because we want to heat that whole area up. And the other cool thing with radio frequency is it gets those fibroblasts that are deep down in the dermis excited, and fibroblasts are our friends. They bring collagen and elastin back up to the surface. So it's almost like we're a bricklayer adding collagen every time you come in for a treatment. That in turn then really gets that skin tightening effect and that better apposition. So when you blink now, we've got tight lids and we're getting that oil coming out every time you blink versus some other treatments we've used in the past, which can heat and express, but they don't do anything for the tightening effect. So the lids are just kind of loose and you become a less efficient blinker. So the meibum then suddenly recedes again and the oil becomes congealed and nasty, kind of like old olive oil that's been sitting in your cupboard for a long time. So how is she doing? We're doing good. We have another question, and then we're going to go to our prizes. Okay, Teresa, how many treatments are recommended and how long did the benefits last? Also, very good question on that, Teresa. Depends on the patient. It's based on age. So if you're about 30 and under, you need about 3 treatments. If you're 40, you need about 4 treatments. 50, you need 5. 1 per decade of life, and that's due to the amount of collagen and elastin loss that happens. 1 to 2% every year after 30, that dirty little secret they never told us about. So again, sunscreen, guys, always make sure you get that sunscreen on because that helps reduce that UVA and UVB damage to the skin. Then we have another question. Terry has a testimony. She goes, the Willamette Valley is the hay fever grass capital of the world. This gives instant relief to allergy eyes. Great point to bring up, Terry. We hit the highest pollen counts on record yesterday in the Eugene and Willamette Valley yesterday. Some of you may be feeling that. So yes, this does a beautiful job at reducing that swelling and irritation. And good old Pataday to the rescue. If you need some eye relief from the allergies, that's over-the-counter Pataday, works really, really well. Okay, wow. Yeah, the questions are coming rolling in. Keith, how long do the effects last for folks? All right, great question. On that, on the lasting, everybody's a little different. A series of treatments never needs to be done again, as long as we are on top of doing touch-ups. So I would say most patients are going to need a touch-up at least once a year. Some of our patients over 55 need one touch-up every 6 months to maintain, but you never need to do a full series ever again. That's a great question. All right. I think I'm going to hand things over to lovely Stevie. She shows that she's Amy, but she's really Stevie today. And Stevie, let's let you take over and talk about the...
Yes. Okay. So this month we are going to spotlight two of our products, our facial products. The first one we're going to do is Bubbly Fresh, because you want to prep the skin for, everything else that's going to go on it. It makes it only work better if it's prepped correctly and has the correct pH balance. So this will be on sale all month long, all month of May, 20% off. The second one will be Dew Restore, and that's hyaluronic acid. That's also 20% off this whole month. Okay, so, and then the third thing we're going to do is 20% off all radio frequency packages. And today somebody's going to win a eyes only radio frequency treatment. You're going to be so upset about that. Just saying, I always tell people, go out and find the woman that you hate the most and have dinner with her that night, because she is going to be pissed. I'm just saying. Okay. So I'm going to pull out 3 names. The first one for Bubbly Fresh is Karen. Karen has Bubbly Fresh. Yay. It doesn't say anything. You tell her. I can't hear. Yeah. Sorry. sorry. So yeah. So the second one is for Dew Restore. And that person is going to win, or the person that's going to win it is Teresa K. So congratulations, Teresa K. Just come by and you can pick that up. And who won the radio frequency eyes only? I'm not sure. Let's find out. Debbie. Okay, Debbie did. She's not our Debbie Downer, but she's our Debbie. She's our cute Debbie. Okay, so you just give me a call. We can get you set up for that radio frequency treatment. And congratulations to everybody. And just remember, 20% off their skincare products the whole month of May. All right, I'm done.
Awesome. Thank you so much, Stevie. Amy, great job. And of course, Gabby, it's lovely to see you enjoying yourself. I think she's asleep at this point. We don't want to wake her. All right, we appreciate all of you of our Foley Vision Center community, and of course, we're going to be doing this live every month, the first Tuesday of every month at 12:15. Spend your lunch, a little bit of your lunchtime with us, and maybe you'll win another great prize. Next month, it's going to be about sunscreen and sunwear and going over what you need to be thinking about for getting ready for the summer. And of course, we're getting gorgeous weather now, but please remember that sunscreen. That's super important. And oh, don't you love that? I want what's going on to Gabby right now, that wonderful massage that Amy does. She adds into every treatment. Oh, it's heaven. All right. Thank you all. Really appreciate our wonderful patients and the community. Enjoy. Have a wonderful day and a wonderful week.
Awesome.
Take care. Bye-bye.